Welcome to Epic Media, your online source for interventional cardiology podcasts. Hope you like it.
The EPIC 26 Velazquez Study is an observational study to analyze the effectiveness and safety of the IHT Destiny coronary stent in a real-world scenario. The IHT Destiny stent is a Cobalt Chromium stent that elutes sirolimus from a permanent dual-layer durable fuoropolymer. It can be considered an ultra-thin strut stent with strut thickness lower than 70 microns. Its open-cell design allows easy access to side branches. IHT Destiny stent has UN unique feature, a low-profile oval-shaped strut with favorable hydrodynamic properties that facilitates a laminar flow, lowering the chances of thrombosis and restenosis. The study has recruited 400 patients from 18 centers in Spain and 1 in Portugal. Full recruitment has been completed during 2023, with the detailed inclusion and exclusion criteria. In brief, all the lesions that could be treated with the available sizes of the stent that were treated with 1 or more IHT Destiny stents were candidates. Exclusion criteria focused on situations that could prevent from a 2-year follow-up, KILLIP class 3 or higher, malignancies, etc., clinical situations apart from common practice, DPT contraindication or programmed discontinuation, or marginal indications, in-stent restenosis, PCI of surgical grafts. The main objective of the study is to assess the effectiveness and safety of the stent in a 2-year follow-up frame, as determined by the TLF, target lesion failure rate. As secondary endpoints, the individual components of TLF will be assessed, as well as the rates of successful device implantation, TIMI3 flow, and residual stenosis lower than 30%, successful procedure at 3 days, definite or probable stent thrombosis, and significant bleeding. In total, 502 stents were implanted to treat 479 lesiones of these 400 patients. Most of the patients were males, with a mean age of 65 years. The population derived from a real-world scenario did not show an extreme risk profile, although some high-risk factors as diabetes were reasonably represented. The clinical indication was predominantly acute coronary syndrome, with acute STEMI situation in more than a quarter of the population. As per current practice in our country, more than 90% of the cases were performed from a radial approach. More than half of the patients were treated with clopidogrel as P2Y12 inhibitor. The angiographic complexity of the lesions was moderate, in vessels with a mean diameter of 3 millimeters. Notably, post-dilatation of the stents was performed in almost half of the cases. The majority of the cases included was treated with a single stent. The acute results showed a very high rate of successful device implantation as well as procedural success, with figures over 99% without any death or emergent revascularization surgery. Remarkably, no cases of acute or subacute stent thrombosis within the first 3 days appeared. We have performed an interim analysis of the results of all the patients at least 1 year after the index procedure. With a mean follow-up time of 16 months, the target lesion failure rate is 1.75%. We can account on 3 cardiac deaths, 2 MIS, 1 related to side branch acuslian in the index procedure, and 2 symptomatic restenosis. None of the cardiac deaths were directly related to the stent: free wall rupture after MI, acute heart failure 7 months after PCI, and unexplained sudden death 1 year after PCI. Total mortality after this follow-up period was 2.25%. Low rates of any further revascularization procedures, significant bleedings, and strokes were detected. As a relevant finding, no case of definite or probable stent thrombosis was communicated. We can conclude that in this real-world prospective registry, a new hydrodynamic ultra-thin strut, sirolimus eluting stent with durable polymer shows high PCI success rate, no acute or subacute stent thrombosis or early repeated revascularization, low target lesion failure rate, and no definite or probable stent thrombosis at midterm follow-up. Thanks for watching.
Thank you so much. See you in the next Epic Media podcast.